Jacquie Cohen Roth, and welcome to another CannabizMD Profile. I'm really excited today to welcome Dr. Rasean Hodge, who I met through the University of Maryland School of Pharmacy, the Masters of Science Medical Cannabis program. He actually was a student of mine in cannabis law and policy, and he is our featured speaker at TPAD Atlanta that we're hosting in Atlanta, obviously, September 12th at One Flew South from 6 to 9. And what TPAD is all about is empowering equitable participation in the cannabis industry through education and professional development. And we're particularly focused on advancing women and people of color in cannabis STEM, that's science, technology, engineering, and medicine. And what CannabizMD is all about is building, educating, and engaging the ecosystem of folks that are committed to delivering optimal patient and product outcomes through medical cannabis. So welcome, Dr. Hodge. Really excited to have you here.
Oh, I'm thrilled and honored to always chat with you, Jackie. It's great. Your initiative is something that's near and dear to my heart. So let's have some fun for this hour, and hopefully we're going to have an awesome event in Atlanta at One Flew South for TPAD. Can't wait.
Yes, it's
super excited.
Live jazz, good eats, plentiful libations, and provocative conversation at TPAD. So we are going to be there, and thank you to the support of Fine Federal Georgia for their support, which is going to help bring in some students. You're a graduate of which medical school?
Morehouse School of Medicine.
Right there in Atlanta.
Yeah. Right here in Atlanta, ATL. So hopefully some of those students can come over and learn and fellowship, and we can learn from them as well.
Yes. Yeah. So, right on point with that is, what inspired you to get into medicine?
Into medicine, it would have to be my parents. My parents are from the Deep South, and they are a firm believer the way to get ahead is with education. So I'm not the first doctor in my family. My eldest sister, she matriculated from Spelman, went to Robert Wood Johnson. I went to Morehouse College here in Atlanta, and I also went to medical school in New Jersey. She's a surgeon, a brilliant surgeon, trauma, burns. She used to run the Grady department over there, and now she's in Mississippi. So I'm the second physician. I'm family medicine. So it was the parents for sure.
I have my father was a pathologist. I have his microscope. And both of my parents were the inspiration. It was education. And was my inspiration for TPAD, is that the influence of my parents, and that was their priority, is making sure that their four children were educated. Pretty much, I lost my oldest sister to breast cancer, part of my reason to be in medical cannabis. I also have a sister who's a surgeon that I say, I'm younger to 4, and I was still scared of her into my 50s. So there's nothing like having a big sister who's a surgeon.
Yeah.
And I also think of my dad.
So we grew up much alike, definitely emphasis on education.
Exactly.
The only way they can't judge you is that,
Yes.
They can say a lot of things about you, but they can't take away from what you know. So
no, that's exactly what you know and what you do. Yeah. I mean, that's it. And and that's the principle behind what I do, both CannabizMD and TPAD, is Tikkun Olam, which is a Hebrew principle that literally means repair the world. That one of the ways that I'm doing it is focusing on educating folks about medical cannabis. I always say it's not a panacea. It's not for everybody. There are certainly some harms associated, but there's also a lot of benefit. And so with your medical school education, was cannabis spoken about at all in your medical training? And if so, how?
For maybe one sentence, nothing therapeutic. It was just punitive and addiction. That's it. That's all I was told. Unfortunately, it's a shame, and I'm pretty sure it's still going on in most of the medical schools, at least in the northern hemisphere, you know?
Right. Yeah, it's my understanding. This is a kind of an old data point, but only 9% of US medical schools include endocannabinoid science, cannabinoid science, whatever you call it, in their curriculum.
Dang.
And so that's why it's important, you know, folks like you, physicians that are out in front talking about it and using it. And so give us a background on how you got into medical cannabis.
Uh, the quick story was I've been practicing for 24 years. I've delivered babies. I do hospice. I do small surgeries. I've done clinical research, and after 2 decades of practicing medicine, you start to get a little jaded, and I had an honest question with myself, like, we took an old first do no harm. I'm trying not to do that, but medicines are right, can cause harm. There's drug-drug interactions. People have allergies. We treat everyone the same, like one pill. They're all going to have the same therapeutic effects. So I've done harm unintentionally. So it came to a point like, you know what? What am I doing? Am I just a sales agent for big pharma?
Wow.
And then 96 happened and California started rolling.
Right.
And fast forward some more, in 2012, I break my neck playing basketball. I end up getting a plate and screw, but plate and screws, C4, C5, C6. Um, and then in 2015, they had to remove those plates and screws and put a plastic sleeve. Um, so to decompress my spinal cord. So obviously I had chronic pain,
Yeah.
depression, a PTSD, body dysmorphic syndrome. Obviously I was hollowing, uh, and conventional medications can treat pain but don't deal with emotions. Conventional pain medications, specifically opioids, have this big laundry list of side effects, which I experienced. Then I couldn't sleep, so now I'm on benzodiazepines like Xanax, Ambien, which have this extremely high abuse potential. I'm with opioids that have this high abuse potential. I'm super sad. Cannabis, help me. Come here. I'm the perfect patient. I was truly drug naive because all they told me about cannabis was that it was bad, bad, bad. So I hired some lobbyists and actively started to try to help change law here in Georgia based off what was happening around in the world and particularly in our country. So in 2015, Georgia successfully passed Haley's Hope, which was named after a young girl, which was having a bunch of seizures, kind of like Figgy. Um, and we passed Haley's Hope Act in 2015. In 2018, we had a bill that was signed for access for growing and for dispensaries. So here I am, still a big advocate. I still use cannabis. I was able to get off all the benzos and opioids, and that's my passion, like yours. I found
Yeah.
happiness, I found passion, I found purpose.
Mhm.
Not that I have a big cape on. I believe there's no heroes in cannabis just yet. The ones that are the heroes are long gone. Again, 96 has been going on. So yeah, I'm with you, Jackie.
That's quite
That's
a
that's why
story, you
I'm
know.
here. Yeah.
Yeah, and I share some of those experience with the traditional pharmaceuticals and what they do to you, and you know, they might numb the pain, but you're not doing any healing. Um,
No.
you know, and you and I had a really powerful Zoom shortly after my daughter Kyle died, and you know, a couple folks had suggested traditional pharmaceuticals, and I know with grief, you know, you got to feel it. You got to feel it, and it's not fun, but you know, is like, I don't want to stay. You know, that's what those pharmaceuticals do. Is you're flat.
You're flat.
You're flat. But in any event, well, you know, kudos to you. So Haley's Hope passed in 2015, you said?
Yes.
Okay, and then when did the so share a little bit about the Georgia market, the
Well,
Georgia medical
Georgia,
cannabis market.
we got started. There's three ways to get started: recreational, medical, and then there's this very reserved and conservative medical approach, which only a few states, and unfortunately, Georgia is one of those states where it's just oil only.
Yes.
You're allowed if a doctor deems that you are eligible for medical cannabis. We have about 23 conditions now that will make you eligible for a card. You're allowed to carry 20 fluid ounces of low THC oil, less than 5% of the total content dry weight. So it's very conservative. Um, the delivery methods are just sublingual right now. It's no inhalation, there's no vapes, uh, there's no edibles, there's no drinks. So hopefully by 2025, by summer, our program will be more robust that will encompass more delivery methods so more people can get a card and get more relief. So that's where we're at.
Yeah, and so we'll jump in right into as that sublingual buccal that you're in, the tissues within. Your body starts absorbing that as soon as it enters your mouth, and then going through down to the digestive system and converting over to THC. Was it double OH, right?
Yeah, hydroxyl.
Yeah.
Yep.
And
OH.
yeah, and that has greater impact of the effects than THC or Delta 9. And so within your practice, so how are you seeing that just this limited access to cannabis as a delivery system, this one singular delivery system?
Well, it's a problem because there's a lot of Crohn's disease, there's ulcerative colitis. Um, there's conditions where, the pediatric patients, we have autism, which is a condition where you can use cannabis. And if you never experienced or tasted cannabis oil, it's very planty. It's very
Earthy.
bitter.
Yes, very earthy.
Chlorophyll, very earthy. So, and we all know we all were kids before. The whole purpose of pediatric medicine is for compliance, and you got to make it taste good for the babies and the kids to taste it because they can't swallow a pill, but if it tastes planty or medicinal, they're gonna spit it right out,
Right,
and
right.
and your loved one, your child stays sick. So there's heavy discrimination with medical discrimination with oil only. So I'm a big advocate of expanding our delivery method. Um, One, because you mentioned that when you ingest the cannabis oil, your liver puts the hydroxyl group on it, and it makes it stronger affinity for that CB1 receptor. So with inhalation, it's more predictable. The onset of action is way faster, but I know it can be eliminated within 3 hours
Right.
versus
Yeah.
orally, it might take 2 days, 1 to 2 days. So patients are like, hey, this is great, but I felt the adverse effects of that oil for like a day. I felt this intoxicated. With inhalation, you don't do that. So again, to answer your question, when patients come in, yeah, we're oil only, but I'm here to help patients. I understand the different pharmacokinetics and pharmacodynamics, but I also understand more importantly what's available to you. And I have to know what's available to my patients and caregivers here in Georgia on the street, in the dispensary, because you came for me for help. I didn't ask you, you came for me for help. So I'm going to give you honest answers. Yeah, if you want this, you got to go meet that person at Starbucks. If you want this, you got to go behind Popeyes and meet that person. But if you want that oil, you can go to a little retail location. So, because I have to do the same. I have to source the same for myself. I got to source the same for families, for pediatrics, for my veterans, from top to bottom for all those 20. I have to source that and make sure it's reliable, make sure it's lab tested and pesticide free. to the best of my ability. You
Right.
see, and I can only keep my patients so safe because some things they need are not in the retail situation because it's oil only. And that's the only way I know is, heavy metals, there's no fungus, bacteria, viruses, there's a shelf life. I know the actual ratio of CBD to THC. I know the terpene profile. I know the flavonoids. I know the expiration date. I know, so therefore I can better help people. So, Georgia's market can be so much better for
Yes.
patients
What do
and
you have? 3 active licenses in Georgia?
yeah, we have three. We're vertical only. There's only 6 grows or five MSOs. And vertical they grow. They have the lab. They have transportation. They get 5 retail with their license. So right now you have Pine Federal, you got Georgia Botanical Sciences, and you got True. So you got 3 active right now. A fourth one should be having retail locations popping up by wintertime.
Yes, and True Leave's another supporter of TPAD, so grateful to True Leave
Thanks
as
to
well.
True. Thanks to Pine Federal for sure.
Yeah, so a couple of things from what you said is as I've though probably for the last year I've had met a lot of folks from Atlanta, and
Yeah, nothing like Atlanta.
yes, yeah, and so understand how really strong and big that the hemp derived, the THCA market is. And so you're talking about why we buy or why we have these regulations is that to ensure patient and consumer safety in the adult use markets. But the lab tested, we know, again, talking to pesticides, heavy metals, all these things that could be devastating for a patient that
Yes.
has, contraindications. So talk to us about this THCA market rather, and what's the good, the bad, the ugly.
Sorry. The THC market, it's good here. Obviously because it's not lab tested,
Mm-hmm.
it could be a major problem. Seizure could get worse, condition can get worse. It could be spice, it could be some type of isomer. But focusing on harm reduction, right?
Right.
The key would be harm reduction. THCA, once you decarboxylate it, you're going to get the same bang as if it was real, right? So it's a loophole in the farm bill.
Right. Right. The
It's
2018 Farm Bill. Right.
yeah, and um, patients need it. So until dispensaries match what's going on in the street, I'm a big fan of THCA. I'm a big fan of Delta 8. I'm a big fan of any isomer of Delta 9 because that patient or caregiver is trying to get some therapeutic benefits. And because of taxes, because the oil is not free, the card's not free, there's barriers.
Right.
Until those barriers come down, let the people live.
So then if you what do you have to say to somebody who is going to the street to get their THCA? There's a story recently where there's an illegal dispensary in Connecticut, and
Mm.
they pulled off the shelf a product that actually was laced with fentanyl. So
Mm.
yeah, so there's obviously some dangers out there. And so what advice do you have for folks that are forced to, for lack of a better way to put it, just go to the street or
Um,
stay on the street?
I've
Right?
been on the street.
Yeah.
So since 2012 when I hurt myself. And it's curious, like, you didn't hear anything about vape pens until 2018, 2019.
This is
You
so
heard about it
true.
for a month and it went away. And now you hear about fentanyl. Okay, who's paying for this information? It's got to be the winners of licenses. It's got to be labs. Um, it's not patients or caregivers, you
No,
know.
and I don't, I might push back on you a little bit. Is like where this is like, you've got these, like big pharma's going to come in and ruin the industry, or just, to what you said, are the MSOs paying to make sure that you hear these bad stories, but they do happen.
They do happen, so few and far between though, Jackie.
Yeah.
It makes you question, like, why do they always try to get us to mistrust mom?
Right.
We're talking about Mother Earth. We used it, the animals use it. The sun gets up, it goes down, so Mother Earth works. It provides everything we need. It has. We invent this hypodermic needle. Now I got to get you and everyone else to now distrust mom. Hey, use this pill. Use that. No, no, Jackie.
So again, somebody's going to the street and buying.
I,
What should they ask? It's who
the
you know.
dealer's not going to educate you. Hopefully you talk to a
No, and then
physician or
and in the
someone in
legal
your
market,
family.
they're not educating you either, right? That's why we're here.
Right. So it's groups and organizations like TPAD, like what you're doing with CannabizMD. To fill in these knowledge gaps, help patients and caregivers to know what they're looking for, and then understand benefits versus risk.
Yes.
So you and I are going to effectively talk about benefits versus risk. And if the shoe fits, go buy it off the street if you can't find it in the dispensary, because it's going to zero deaths.
Yeah, and you brought up, harm, it's harm reduction, harm mitigation is why it is so important that we need public. This is a big area of focus of mine, is just keep hammering on our public health officials. And to talk to that big sister who doesn't scare me as much anymore, but I said to her, we were together in April, and I said, you can't keep your head in the sand. Is that she both, as we share that experience of having physician parents, and if you smoke weed, if you're caught with it, you're never going to be able to become a doctor, right?
Big sis ain't cool with it, right? The surgeons aren't cool with it. Nope.
Well, I'm going to share a story about that offline, but is that what I said to her is, you can't keep your head in the sand. Is that you've got patients who are using medical cannabis that are coming into your orthopedic practice. You have patients who are using CBD. You have patients who are using the gray market, which means that, Sally down the street said, oh yeah, this helps me sleep. Here's some gummies. And then you have people just, again, buying right off the street. So that's why, hammering on that it's a version of malpractice that's starting in your medical school curriculum, that cannabis is, you said a sentence, or that it's spoken about in your addiction class, when you start covering addictions. And, again, I always say, there are certainly risks and harms, but there's a whole lot of benefits. And as physicians, healthcare providers, you have to understand those contraindications, drug-drug interactions. If you would, explain a drug-drug interaction where cannabis doesn't work with, what should somebody know? Like if you are taking, say, a blood thinner, how many people in the world are on statins? And so what can happen to you if you're using your statin, if you're using cannabis?
Well, your body, two things can happen. What doctors intended for that drug level to slowly dissipate and be excreted in your kidneys, through your kidneys and feces, it might stay in your bloodstream longer than intended, which is a problem. Or it can stay in your bloodstream too quick. We want to stay a little longer. And now you're not getting any of the therapeutic effects, or you're getting too much of it now if it's a poison. So those are two things that can happen. It can either stay in your bloodstream too quick or too long, intended from the physician.
So
that's a drug to drug.
When you have this, I'm sorry to cut you off.
I say it can cause problems. It can be fatal. Drug interactions kill all day, every day.
Yes. Yeah. And so then that kind of segues into interdisciplinary collaboration. So with your colleagues, your fellow physicians.
Yeah.
So
They're green. They're so naive, Jackie. They don't know. I just did a podcast with the Morehouse School of Medicine, our family medicine department, and they're like, "Look, we got so many patients and caregivers that ask about cannabis in a card. We don't know what to tell them."
Right.
And we passed this law again in 2015, but they don't require any physicians, pediatricians, nurses, LPNs, MAs to get any certified medical credits, CMEs, right? Which need to be mandated.
I'm with you. That's my raison d'etre. I have sworn for our Maryland 2025 legislative session is to get out in front. And I've been about this, that the requirement that our licensed healthcare providers need to have a minimum of 2 hours. We're talking 2 hours of your life to that could say likely will save somebody's life, right?
Yes, minimum 2 hours, and it's not just health. Even the chaplains need to have minimal hours because end of life care is a criteria for cannabis in every state that has medicinal programs,
That's a
and the
great
chaplains are
point.
always there. So even the theological schools need to get some CME credits on cannabis. So it's super important, again, to help that patient and caregiver be compliant. The whole reason why a patient or caregiver comes to see a physician or healthcare is for some medical advice. And if that medical advice is going to come with some type of contract, that contract is, hey, either you're going to exercise, 6 days out the week, you're going to start sleeping, you need about 8 hours. I definitely need you to screen time, reduce that, lifestyle changes. But I need you to be compliant.
Yeah.
When you leave that office, I'm expecting you to do them things.
Right.
Now, if I have to prescribe something that you take every 8 hours, 3 times a day, or 6 hours, 4 times a day, only at bed at nighttime, when you leave, you have an understanding, and I have an understanding that you're going to do that. Same thing with cannabis. If we talked and you said you're going to be doing this 4 times a day, you got to have access. It's got to be clean. It's got to be the safest. Compliance. I'm expecting that you're going to do it. So yeah, we need all the disciplinaries to help the patient follow the contract.
And then with that, and
get better therapeutically, treatment, and possibly cure.
Mm-hmm. And you have to be careful of that, right? Of what you can say, or that within the School of Pharmacy, we don't use treating our patients with cannabis. We're managing their symptoms because of being federally illegal. Can't make any medical claims. We have to be very careful what we say about that. So, we're touching upon public perception, and particularly in the communities, the Black communities and brown communities that have been most harmed by the war on drugs. So, great understanding of what the devastating effect that folks that were, that are, I guess, well, I'm a grandmother, so of that age, that, growing up in the 60s, 50s, before this, with the we have over how many years now of are we close to 60 years of federal drug policy that is based on racial prejudice. As simple as that.
Prejudice, yeah, I agreed. Hard to disagree.
Yeah, and so then how do you, as a Black man, Black physician in the community, has helped shift and shape public perception within communities that have been most harmed by this war on drugs? And I don't mean to dismiss that with my air quotes, but it has been a war on communities and people.
Oh, it's been terrible. That's part of my legacy, for real. Probably the proudest things I've done outside of partially delivering my son.
Oh,
wow. His shoulder got stuck. Would have been my final delivery, but he's my final. But yeah, I wanted to be the first to touch him. It was something important to me. But
oh my goodness, he's giving goosebumps. Yeah.
Yeah, outside of that, to rebuild community, you have to establish trust.
Mm-hmm.
So since I broke my neck and found relief, I started to, and once I started to, source and start helping patients in our community that looked like me, sickle cell, cancer, they had diabetic neuropathy, you survived a stroke, you got chronic pain, PTSD, HIV, AIDS. It's trust. I started to actually see trust. And that is the foundation of community.
Mm-hmm.
So we're building here in Atlanta. Like it's just cannabis community, and it's an underground, but it's a real ass community where we trust one another. It's a real ecosystem. I got something, some products. You got some products. Let's all share. So it's community. It's an ecosystem. We're getting money. We're getting healthier. We're understanding, and um, there's power in that. So because now that information you trust it, and that little bit of success begets more success.
Right. Right. Right.
Life
Reach back and
expectancy
bring forward.
changes. Yeah,
Yeah.
because that harm, these draconian laws, the prejudice, um, and now, we're talking social equity. The majority gets 90%, 98% of that when they don't share 98% of the pain. So now the community, as we grow, how do we get the 98% that are winning, and we're the 2% that are left with a bunch of can't vote, can't get SNAP, can't
Mm-hmm.
can't get these certain jobs, you just can't. But now that we said it's good and we said it can help people, we go to the front of the line. And going to the front of the line is generational. When do we get to walk in our foyer and get to see a picture of grandma and granddad say they started this grow, they started this lab, and I'm a descendant of that. I own that, and now look, one day, Buckaroo, you're gonna own it.
Mm-hmm.
It's not gonna happen. And social equity, you can understand the words, but you got to understand the pain of and the hurt I feel in my soul, knowing that's not going to happen. I can't say, "Hey, little Johnny. Hey, little Buckaroo. Hey, little Rashawn. Um, you know, this is what you're going to inherit." Even though we paid the ultimate brunt of this price of this failed drug war. So, as states turn and they have legal programs, they talk about social equity, but we really need for these legislators and for these donors that are trying to get the business to understand the pain of the 98% that are not getting an opportunity to participate in this cannabis opportunity for cannabis equity. How do we get you to understand this pain? And as I think about talking to you, Jackie, I'm like, we're living in an age where we're okay with talking about emotions. I can, if I looked a certain way and I say, hey, that caused me pain, you might say, hey, you're right. That's a hate crime. That's a felony. You're going to go to jail for causing that person pain. And it wasn't physical, it was something you said. And a lot of groups, ethnic groups, can say, hey, you caused me pain, and there's punitive problems. Every time there's a license or a dispensary awarded, or you get this transportation and it don't look like me, you cause me pain. But when I say, hey, you causing me pain, hell with your emotions is pretty much the answer. That's sad.
Yeah, it's
And you get
real.
a bunch of oppressed people. That's how I feel in my soul. I'm not the only one. You get a bunch of people feeling like that. And now what do we feel? We feel like we want to divorce America, right?
Hmm.
Now, what do you, and then Now you are walking around with people that are ready, that feeling like they're ready to divorce America, you know. Now that's hurt, harm, and danger for you because you can't blame that person for feeling like, hey, why am I here? Nobody cares. I love this place, but this place don't love me. Yeah.
Yeah, that's powerful. You know, it's where I am based in Maryland, and I've shared this a couple of times online with, we have the dynamic Governor Wes Moore. And
Yeah.
when
Doing
I
a
had,
great job, man. Salute to
yeah,
him.
but I challenged him. I had the opportunity to see him a couple of weeks ago at a fundraiser. And you know, he made this historic move of pardoning 175,000 possession convictions. And he was talking about the equity that exists in the Maryland cannabis industry. And I said, it does not. There's no access to money. So there is no equity, you know, and so, yeah, Rasean, what are the priorities? And this is, you know, some of the provocative conversation that we'll be having at TPAD is,
Right.
what do we need to do? You know, it's one thing is, here's a license, but how are you going to get money to launch a multi-million-dollar company and keep it running? And make sure that when Rasean Jr., you know, will go in, or Rasean the third is going to see his grandfather's
Right.
photograph of starting this phenomenal business. How can we, what do we have to do?
Yeah, that's it. I mean, it starts with the people in that room. Um, you understand the assignment. Like, look, forget competition. Those days are over. This is something that we all have to collaborate. Put egos aside, put what you did aside. I don't care about titles. We all got to be this super team, a super force to say, hey, look, we're all going to collaborate to achieve this goal or we shut it all down. You know, not like kind of like into the bus strikes. Shut it all down. Don't use it. Don't participate. Stand in front of it. Make people feel like shit for walking into that retail location because they don't care about everyone. It's not inclusive. Not just the financial hurdles. You just don't understand my pain.
Mm-hmm.
And when you go into that store, when you cross that door, oh, it makes me feel so bad. Why does it make you feel so bad? Blah, 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 blah. Fill in the blanks, man. I don't got to tell you why it makes me feel bad that you're going to go in this retail something that I can never own. You know, something that, you know what, my kids can't get. I'm stuck on this Medicaid, Medicare, pharmaceutical crap where you get to explore these other safer options. I can't do that. I'm on a fixed income. I can't afford that. Fill in the blanks why I'm pissed.
Yeah, and that goes right
And
to,
the only reason why we can make change here, especially in Atlanta, because we're good at teaming up.
mm-hmm.
You know, we just need to understand the play. Once we understand the play and understand how we're getting played out, yeah, you're gonna have a force here in the city.
I'm going to stop right there with, I
Yeah.
think we've got a cliffhanger on our provocative conversation at TPAD. And
Yeah.
making the plan.
Oh,
Yep. And
yeah.
as you're showing those biceps, is obviously what you're doing is working for you for coming through significant an injury and treatment and where you are today. So as you said, mom works, the mother plant works. Again, not for everybody, but
Mom works.
okay. So then what do you think about with where we are? This is August, and we have who we have on the Democratic ticket with Kamala Harris and the VPIC, white man, 60. They're both the same age. It's a really funny meme on IG, you know, where here's this old white man, but wait, I think they're like 3 months apart in age. But in any
Right.
event, on the federal side, so you have the governor of Minnesota, and then a former prosecutor, and who was not, you know, the rumblings that I had heard about her not cannabis friendly. So from President Biden we now have on the table of rescheduling cannabis from 1 to 3. What do you think is going to happen, and what do you think are the benefits? Is rescheduling going to happen 1 to 3? Are we going to go straight legal?
I think we're gonna go to reschedule to 3 before we go straight legal. One is just basically because of harm reduction.
Mm-hmm.
The VP, he's the governor of Minnesota, which speaking about cannabis, we copied their program. They were oil only, just like
Yeah, they had
Georgia.
this crazy loophole.
Yeah, it
Yes.
was.
Yeah.
They came out super conservative. Um,
My understanding,
our,
legislators didn't know what they were doing, and next thing you know, there's
right. Our
cannabis infused
legislators
beverages. Yeah.
visited Minnesota, visited legal markets, visited, more aggressive medicals. But when they left Minnesota, we copied. Years later, now they're legal. So I tell Georgia, look what we copied. We copied Minnesota. And all they did was get data, less, there was nobody was running in the streets naked. No one was having sex, nobody was raping. Nobody was, okay, actions are going down. They were getting all this data and the
Right.
usage was going up, right?
All
And
these
now
data, and it
legal.
supports, yeah.
And now it's a legal market. So, and the governor signed off on that. So
Mhm.
I'm excited for Jordan's like, look, just be patient. Look what other models that started just like us have done. So our future will definitely be just as bright as Minnesota. But to have someone in office that understands that, my opinion, cannabis will go from a drug having no therapeutic effect, Schedule 1, high abuse potential, no way to control it, to possible Schedule 3, Schedule 4. Creating 2 lanes. The normal market will still exist, but then there's going to be another market that there's going to be combination pills. There might be a little bit of opioid and a lot of bit of a terpene and a little bit of CBD and this tried drug pill that's going to effectively treat migraines, chronic pain, surgical pain, and it's going to be way safer than the oxy, way safer than oxycontin. So there's going to be, and you can use insurance. So these 2 lanes are both beautiful. You know, great
Yeah, and
news
that's
for
when
me.
we'll be able to address, part of our conversation is essentially what we've been talking about is also health equity, the lack of health equity that there is. And,
Yes.
and that when we have insurance, and, like it or not with big pharma is, they're already in this industry. And with big
Yes.
pharma in the industry, there are skill sets, knowledge assets of how to conduct clinical trials, how to bring a drug to market. So this is what we're going to see with cannabinoids, terpenes,
Yeah.
new
Yeah.
products coming to market, and
Absolutely.
you being
Yeah.
able to actually prescribe it.
Yeah, we'll be able to describe it. And we got to remind people there are FDA approved drugs. So as soon as this gets descheduled, there's not drugs that, hey, no, you can go to a compounding pharmacy because you still got to go to that IRB approval, which you just mentioned, which takes years. So you're not going to have this robust list of products to say, hey, doc, cannabis is now a drug. You still got to do the research and the
Yeah.
eight
I mean, this
years of
isn't going to be a
pipeline,
light
yeah, and
switch.
all the money. But it's just the options are coming. We can make more health claims because there's so much popular opinion. Only a little bit of what we can say is real,
Mhm.
but we know the popular opinion is real.
Yeah, I mean, that's the anecdotal evidence that we have.
We
You're in
know.
it.
Yeah.
You're in
Yeah,
it.
come on, man. So it's exciting. What about what you think? What do you think? What do you think? What are your
Yeah,
thoughts?
I think, thank you for asking me. Schedule 3, and that recognizing it's not just going to be flipping a switch. This is going to take years. but it is going to be a game changer, and this will then, all that much then more pressure on requiring our licensed healthcare providers to have medical or to have cannabis science in their curriculum.
Yeah, we need to
And
start that too. I want to help you with all that curriculum, please.
you got it. I'm talking to Georgia right now.
Yeah.
Mom works in more ways than one. She does. So I want to thank you,
Yeah.
Rasean, for your time
Yeah.
on the CannabizMD Profile. Real excited to see you in person, September 12th.
Oh man, yes,
And
let's fire them up.
yep, and your friend Gips helping us set up some good music that we're gonna have. That's what that live.
Shout out to Gip and Goody Mob,
Yep,
the
yep.
whole Dungeon family. Peace and love from Doc, Jackie. Thank you so much for being part of TPAD, for sure.
Thank you. Thank you.
Yeah,
All right. Thank you
I
so
love.
much.
All right, peace and love, peace and power. Thank you.
You're welcome.
All right, ciao.
It's gonna light up